Hi everyone, it's Dr. Rick, founder of Herbal 411. Before you click off, I just wanted to present to you an option that might keep you motivated through this dark winter holiday season. A lot of us will tend to overindulge during times of feast, and that's okay. We have Halloween, Thanksgiving, Christmas, Hanukkah, and we have New Year's. So there's a lot of feasting, which will keep us engaged in the social part, keep us engaged in the eating part. Unfortunately, a lot of my patients are already a little bit overweight and have a challenge. I'm here to propose to you a concept that I believe keeps my patients engaged more than other patients in standard practices. So for those of you who don't follow me, I am Dr. Enrique Seguil. I'm an integrative medicine primary care doctor with sports medicine training, a yoga practitioner and teacher, and also a hiking guide. So I'm always out in nature, and I have my own spiritual practice that I engage to keep me motivated. And that's what I wanted to present to you. New Year's is coming up. Usually after the second week of New Year's, most people will give up and become demotivated because it's hard. It's hard to lose weight. It's hard to start an exercise program, especially if you had no guidance. And it's hard to find a community that's somewhat affordable to keep you engaged. And believe it or not, there are studies that have been done. This is the Dallas Heart Study. The Good News participants to figure if spiritual practice was better than secular practice, meaning if you had some form of spirituality and or religion versus nothing at all, would you keep to your healthy lifestyle changes longer? And it did show a positive correlation. Yeah. Those of you who are very good with reading data, this was questionnaire based, so there's some error with that, and it might be biased too, because a lot of people that typically go to African American churches are very motivated to participate in the social gathering, and if that social gathering happens to do a little exercise, that's the motivation they need to continue. But regardless, even if there is healthy user bias, who cares? There's no downside to having a religious or spiritual practice. And that brings me to the next article that I found in a family practice journal on a spiritual assessment. Most physicians in the US do not ask anything about spirituality. The definition of spirituality versus religion sometimes narrows down the answers that you can generate or engage as a doctor and a patient. When you change the inquiry to spiritual practice, that could include meditation, mindfulness, nature therapy, a little bit more encompassing. What was interesting in the article for physicians is that a meta-analysis has shown that a large amount of people going to the doctor's office are interested in finding out about spirituality or searching if they have to add that component to their lifestyle change. But yet doctors typically don't ask those questions. Those of you who have been to my clinic, I always include spirituality in my intake process. And I used to hide that because there would be a few patients that would be a little triggered to say, I don't want to talk about spirituality, or when I ask a question, what is your spiritual practice? Most will say, well, I don't go to church. And it's a lot more involved than that. If you look at population studies like the Blue Zones by Dan Buettner, there were 5 places on earth where people lived to 100 and were independent and thriving. One of those places was in the US, Loma Linda, California, with the Seventh-day Adventists. And it can be linked that when you have a spiritual practice, you'll be anchored into your lifestyle changes to last longer, which is the bottom line of why I put Talk to Me Goose as the title for my video. Those of you who watch movies and Top Gun, and was just recently released as Top Gun Maverick, at the end, during the most crucial part of the movie, you heard Tom Cruise whisper to himself, "Talk to me, Goose." And you heard his Rio behind him say, "Talk to me, Dad," right before they're about to die. Although it was a movie, I think it reminded me of the fact that a lot of people will usually find religion or spirituality at end of life. So a lot of my patients have some kind of hesitation on grabbing spirituality. I'm not sure why. It could be because we were oversold, over-evangelized. In my day, I remember answering the doorbell and having missionaries come and try to talk your head off. And back then, as a kid, it's very uncomfortable for me to be talking religion to some strangers at the doorway. But as your provider, I have to tell you that if you're going through high blood pressure, heart disease, diabetes, obesity, autoimmune disorder, or worst case scenario, cancer, you're in for a long haul challenge. And if you wait until that challenge hits to find spirituality or find your religion, you'll be a little bit behind the 8 ball. Kind of like what I always profess in my other videos. If you wait until the disease process occurs and then you make the lifestyle change, it's never too late, but man, you're up against odds that will really decrease your success in conquering your disease process. Even if it's cancer and end of life is coming, I think it would still be helpful to grab a couple more weeks, months, or years. I feel that a spiritual practice might give you that to endure the suffering you're going through. I lost my mom to pancreatic cancer and she decided not to do chemotherapy, and that was fine. But she had a very good spiritual practice. I think she would have done fine if she did take on the Whipple procedure or chemotherapy or other intensive treatments that Western medicine offers, but she decided not to, and we honored that. But I challenge those of you who are going through a crisis, or those of you who have relatives that are going through a crisis, to stay grounded. It would be helpful to already have a spiritual practice established. I don't want to make this a tearful video. In fact, this was more for New Year's. And just to self-promote, I will be hosting an Ignite Your Life conference the second weekend of January, when most people fall off the wagon as far as New Year's resolutions. Again, we all need a little bit of help with regards to lifestyle change, because most of us do have a little bit of weight issues, a little bit of blood pressure issues, cholesterol, diabetes, or just plain old craving issues. Or if you're a couch potato, you know that that's not going to help you in the long run. It'll probably harm you. It's just that when I suggest that you should exercise and diet or reduce calories, everybody's like, oh, I don't want to do that. I'm a Catholic, and my son, Brandon, brought me back to my faith. But I was somewhat a lax Catholic. That means you don't go to church, you don't really practice it. Kind of like a Catholic that's agnostic at the same time. This is my medicine for maintaining the exercise and nutrition that I always engage. I don't talk about it in my videos, but this is a paracord rosary. My practice is to do rosary in the morning, do rosary at night, and in times when I'm challenged. It helps keep me grounded, and the data does show that people who have a faith-based practice will usually lower their anxiety and depression more than patients that are suffering without any form of spiritual or religious practice. I even have this book that I found, How Exercise and Religion Go Hand in Hand. So the bottom line is, if you don't have a religious practice or spiritual practice, you can certainly work your way into it. I take people on hiking excursions. Being in nature actually is the first stepping stone to developing a spiritual practice. Those of you who have been to my excursions know that when we get to summit, I usually will tell everybody, just pause for a second, take a deep breath. And there's no question, when you get to a vista, especially at 14,000 feet, even if you don't have a spiritual practice, you will be taken by the majesty that you belong and have a source that you've never experienced before. And there is this oxytocin, serotonin, endorphin rush that you get when in nature. And I propose to you that you'll have the same thing when you have a spiritual or religious practice. But like going to a hiking excursion with me, you must train and you must practice it over and over again. It's not like you say the rosary once and you become enlightened. It takes a little bit of time. But like anything, when you invest in the key elements of exercise, nutrition, spiritual practice, and good sleep, you will be bulletproof to the diseases that are coming your way. And I don't care if you have no symptoms, you're skinny, if you exercise. As you age, diseases will present themselves. Don't wait till the last minute. If you are seeking some advice as far as how to connect spirituality or religion to exercise, diet, and lifestyle change, come be a patient at Herbal 411. I'll put the link here. I think and see that my patients have better outcomes. And I have to stress for the doubting Thomases out there, whether it's placebo or not does not matter. If you can make the change, then I would do it. Changing nutrition costs money. Engaging in exercise costs money. Finding your spiritual practice doesn't cost you anything. So what are you waiting for? Come out to the Ignite Your Life conference in January and meet other folks who have been very successful with their lifestyle changes. And maybe we'll all grow old as a community. Enjoy your holiday season and start prepping for your 2023 turnaround. Thanks for watching, and God bless you.